Alright, here is a case from OBGYN. Feel free to pause the video or even take a screenshot and read whole case in detail. Here I have used different colors, but you guys can simply underline the important points in the question. Our patient is 28-year-old female, she is married, she has no period for 45 days, right lower abdominal pain for 4 hours. Her physical examination shows low blood pressure, pale face, and more importantly positive shifting dullness. If you have forgotten what shifting dullness is, then, shifting dullness positive means patient has more than 1,000 milliliters of fluid in the abdomen. Irregular mass in the right accessory area is found in her gynecological physical examination. So these are the important information from the case, and our next step is to correlate these informations and find out the initial diagnosis. Married female, her age, amenorrhea for 45 days, lower abdominal pain and irregular mass in right accessory area. With other findings, you could say this is an ectopic pregnancy, and we believe it is located in the right fallopian tube. Here, if you closely inspect her blood pressure, which is very low, we definitely need a reasonable explanation. And if you try to relate her BP and shifting dullness, which is positive, meaning she has more than 1,000 milliliters of fluid in her abdomen. Now I believe we have an explanation for her low blood pressure. First, she had an ectopic pregnancy, then it got ruptured, bleeding and deposition of more than 1,000 milliliters of blood in the abdomen, which means positive shifting dullness. So our initial diagnosis is ruptured ectopic pregnancy, or if you want to be more specific to position, you could say tubal pregnancy, since most of the ectopic occurs in fallopian tube. And once again, why would you say ectopic pregnancy? Because of amenorrhea, abdominal pain, irregular mass. Remember, amenorrhea, abdominal pain and vaginal bleeding are very important findings of the ectopic pregnancy. Why is it ruptured? Because her BP is 80/50, shifting dullness is positive, her face is pale, and these cannot be explained by any other causes than a ruptured ectopic pregnancy. Our second question is the treatment plan. Early ectopic pregnancy is treated with medications, but keep in mind more than 50% of ectopic are found when they are already ruptured. Surgery is the only option for ruptured ectopic pregnancy. Educational objectives of this case are ectopic, ruptured ectopic, and treatment plan of ruptured ectopic pregnancy.